got to get back in time to introduce Colin because he's working on a really awesome project. Yeah, I got a chance to like interview him and like really go into the project, so I think you guys are gonna enjoy it a lot. He's the co-founder of PeerAtlas, a completely free online medical resource for high-quality medical information, and he's a 2017 graduate of Ross University School of Medicine. So he's got a very interesting background for blockchain.
Hi, my name is Dr. Glasser. My friends call me Colin. I'm co-founder of PeerAtlas. PeerAtlas is I'm co-founder, our medical information project based on NEO. So we are a tool for doctors and other medical professionals to make clinical decisions in the clinic, like at a professional level. Okay, so this is NEO DevCon, but I have a little bit different background than most of the talented people in this room. I'm here because I'm a doctor, but I'm also here because I was trading ant shares this summer. So putting my hands on the markets allowed me to understand crypto well enough to come up with a business plan that makes medical information free while still having a revenue source. So let's go to the vision. And these slides, okay, so these slides, I've been doing the world tour for a little while, a few months. This slide has not changed since Manhattan. Since 2011, my good friend Dr. Mattson and I have made it loud and clear to the universe what we want. We want high quality medical information to be free. Right now, it's behind a subscription paywall. So the problem is that, like I say, the gold standard of information in medicine is subscription-based. So the solution is to remove the subscription. PeerAtlas is our project. It's an open source medical encyclopedia supported by the digital Atlas token. Atlas is an NEP5 token powered by NEO. PeerAtlas is not a Wikipedia, although we have some of our ideology in common with an open source resource like Wikipedia. We are not a wiki because we pay and reserve the option to pay our professional contributors. We encourage crowdfunding, voluntary tipping, especially in the long term, and we will be buying content up front in the short term. This is our competition. This is the gold standard of Western medicine, in my opinion. This is UpToDate. UpToDate is another clinical decision support tool. If you are a nurse practitioner or physician, you would have this most likely on your hospital computer. We have arrhythmia management for the primary care clinician, meaning like irregular heartbeat. And we get to the introduction, and right after the introduction, these buttons here are the paywall. So it's not possible to extract the information from this website without logging in. And a subscription is $500 a year. So my concern is that a lot of doctors in places that can afford this subscription do not subscribe. And then, of course, also the doctors who cannot afford to subscribe in other areas of the world also do not have access to this information. So our roadmap is actually more than just the medical encyclopedia side of things. It goes on, I would say, maybe 20, 40 years, my career. If it's successful, I'll definitely spend the rest of my life working on this, and I'm 35. So our first goal is to build a world-class medical library that's freely available, like without logging in. Goal number 2, this would be a few years down the line. If we have a world-class medical library, then we can integrate it with patient data from existing EMR software. Now, as I outlined in the white paper, there are a lot of hurdles to doing this, such as privacy laws, evolving government regulations, a lack of a clear number 1 EMR software, but this is a longer-term goal. And that goes hand in hand with the treatment recommendations. Once you have patient data, then you can modify your treatment recommendations to reflect the data that you have about the patient, to change the possible, what might be right treatment for one person, another person might benefit from something else. So the holy grail to all this is AI, like bringing machine learning. I know these are buzzwords, but this is our dream. Machine learning to medicine by using the anonymous data to have a live rolling clinical trial where the the AI can learn, can get feedback on the efficacy of treatments. And currently, this does not exist in Western medicine. So I did mention Wikipedia. We did mention open source. There is a profit mechanism. We will issue continuing medical education credits to physicians that use the site in the same manner that the industry standard UpToDate, our main competition, they also award CME credits. So this is an existing mechanism in Western medicine. 14 million physicians and 12 million non-physicians redeem CMEs every year. So these are potential customers. And the PeerAtlas Foundation will redeem credits for the token. This is total CME revenue. And we don't have every year available, but we do have between 2007 and 2014. So you can see that we're above 2.3 billion US dollars every year. These are the physician participants and the non-physician participants. We're climbing pretty much every year. So why a token? The Atlas token, people in China can tip a doctor in Zimbabwe for creating something useful and vice versa. So if we want to be an international community, a borderless token is a great way to facilitate that. And we do want to be an international community. And then also with the long-term roadmap, widespread adoption of Atlas and the PeerAtlas library will make the Foundation's Atlas tokens useful for research and development on its long-term roadmap, which is quite ambitious, despite its long time frame. So in terms of ethics, I'm very proud to have designed our platform with a particular focus on remaining independent from revenue which can bring conflicts of interest, such as subscription revenue, ad revenue, money from drug companies or the manufacturers of medical devices. PeerAtlas, our revenue is independent from all that, and I think that's important so that it doesn't influence the recommendations of the library. And the identity of the people that are creating and evaluating the medical articles and algorithms on PeerAtlas is important, that people trust who they are and who they say that they are. So we rely on digital identity verification, and NEO is a great blockchain for us to be on. It's a very natural fit for our project because NEO has NEO ID and many other projects and partners that deal with digital identity verification. So PeerAtlas and the NEO blockchain that powers it are a very good match to make the project come to fruition. And so, yeah, our message hasn't changed much in the last 3 months. We've made a tremendous amount of progress on the business front. Our team has doubled or tripled in size. But our core message is still that we want to make medical information free, and we have a dream of medicine available worldwide in every language without a paywall. That's my project. Thank you for listening.